Hi, everyone. Thank you so much for joining today's virtual education program with Cancer Support Community Los Angeles. My name is Kelly, and I am so very excited to welcome you to this week's webinar titled Getting Ready for Medicare's Open Enrollment Period. We're here, we're in it. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs like this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. You may, however, enter your questions into the Q&A feature found at the bottom of the Zoom window at any time. Questions will be answered at the end of the presentation. We may not be able to get to all your questions, but our presenter will be sharing her contact info, so there will be plenty of opportunity to answer more in the future. Without further ado, today we have Stephanie Fajuri, who's the HICAP Program Manager, Staff Attorney for the Center for Healthcare Rights in Los Angeles. Prior to this position, she was director of the Cancer Legal Resource Center, a program of the Disability Rights Legal Center, where she provided legal information and education to thousands of people affected by cancer across the country. She earned her JD at Chicago-Kent College of Law and her BA in history at the University of Michigan, Ann Arbor. And she's a member of the state bars of California and New York. It gives me great pleasure to welcome today's speaker, Stephanie. Welcome.
Thanks so much, Kelly. So happy to be here. I'm going to go ahead and share my screen. And we will get started today. As Kelly mentioned, I'm going to do my best to leave time for questions at the end of the presentation. I find a lot of times the questions that folks ask during the middle are actually answered by later slides. So I'm going to go through some of this a little bit quickly. So hopefully we'll have plenty of time for Q&A. Okay, so a little background on our organization, Center for Healthcare Rights. We are a nonprofit organization based here in Los Angeles. We provide free education and assistance specifically with Medicare. We serve Medicare beneficiaries in LA County. And one thing to keep in mind about our program is that we are the ones that run the HICAP program for the city and county of Los Angeles. HICAP stands for Health Insurance Counseling and Advocacy Program. And for anyone who's already on Medicare and ever receives that Medicare and You book, the book that might have just come out is Medicare and You 2024. Our phone number is actually the one that's on the back of that book. It's that statewide number 1-800-434-0222. You're welcome to check out our website. We have a lot of really helpful resources, brochures, flyers, educational fact sheets. And the other thing to keep in mind is that because we run the HICAP program, we are actually required to be neutral, unbiased. We do not sell anything. We do not sell insurance. We do not endorse or recommend any specific companies or plans. So any information you get from us is free and unbiased. So we really welcome your calls about your Medicare questions. The last thing I'll say about this is that although I'm happy to try to answer questions today, if something else comes up or if you do need one-on-one assistance with respect to open enrollment specifically, I highly recommend you give us a call as soon as possible, because open enrollment goes through December 7th, but we do tend to get very busy during this time, and we book up for appointments typically weeks before the end of the open enrollment period. So please feel free to give us a call for more assistance. And we are available year-round too. So if your questions are not specifically related to open enrollment, you might want to give us a call after the open enrollment period ends. Okay, so what are we going to talk about today? What is open enrollment? How do we compare coverage options? When can you change plans? Part D costs. And then I'll also share a little bit of information about the Extra Help program, which can help folks save money on their Medicare prescription drug coverage. So what's open enrollment? Well, as Kelly said, we are already in it. It started October 15th and it goes through December 7th. And this is the time of year. So this period is every single year, October 15th to December 7th. And this is the time of year not to necessarily sign up for Medicare for the first time. Typically, you will have already signed up for parts A and or B, either when you reach age 65 or once you retire, or we also talk with a lot of folks who become eligible for Medicare due to receiving Social Security Disability Insurance, SSDI. So you would have already gotten enrolled into parts A and or B at that time. This open enrollment period is for drug coverage specifically, Part D as in drug, and Medicare Advantage plans, which are also known as Part C. They also typically include the drug coverage, which is why they're looped into this open enrollment period. So this is the time of year to compare your drug plan options. Any changes you make during open enrollment become effective January 1st. So a couple things to consider. First, what kind of coverage do you currently have? If you don't even have Medicare at this point, you don't have to worry about the open enrollment period. We can talk to you about your initial enrollment period or special enrollment periods to sign up for Medicare more broadly, but this time of year is really specifically for changing or comparing drug plan options. Are you happy with your coverage? Do you have a plan that you really like? Is your plan changing? You're not required to make a change every year. We recommend comparing options to make sure you're in the best plan for yourself, but you're not required to. And if nothing's really changing and you're pretty happy, then you might not really have to do much this open enrollment period. Other things to keep in mind: what is important to you when it comes to your healthcare? Are there specific doctors or hospitals that you want to keep using? If you have an oncologist that you've been working with for a long time, you're going to want to confirm with that doctor whether or not they even accept some of these plan options before you would want to consider making a change. And then, of course, another thing to keep in mind is the financial piece. How much are you currently paying for your coverage? Is that too much? Are you able to afford that? Are the prices or monthly premiums going up? There's lots of different factors to consider when we're talking about open enrollment. So I might say this a couple of times today, but one thing that I strongly believe is that there is no one size fits all Medicare coverage option, right? We know everyone has different financial needs. Everyone has different healthcare needs. Sometimes people living in the same household don't have the same health coverage because they have different needs or different networks of doctors that they need. So Please keep in mind that this is a very individualized consideration, and that's part of why our agency provides that one-on-one assistance to help folks understand and prioritize what's important to them. Okay, so thinking about open enrollment, we have these two main coverage options for drug plan choices. The first is what's called a prescription drug plan, also known as Part D. This is where you are continuing to use what's called original Medicare, that red, white, and blue Medicare card that some of you may already have, to obtain your Part A and B covered services. It's sort of an open network. You can go to any doctor or hospital that accepts Medicare, and then you get a separate standalone prescription drug plan. The other option is what's called Medicare Advantage, or a Medicare Advantage prescription drug plan. That's what that acronym stands for, MAPD. And that's where you're receiving all of the parts of your Medicare A, B, and D all through one plan. So for my more visual learners here, I have those same two options here, but with a few more images. So on the left, we've got Medicare, original Medicare, or traditional Medicare, regular Medicare. It's referred to as all sorts of different things. Original Medicare, that red, white, and blue card with your Part A hospital coverage, your Part B outpatient coverage, doctor, medical coverage, and then a separate prescription drug plan. On the other side, we've got Medicare Advantage plans. These are also known as Part C. And I like to think of Part D stands for drugs. That's pretty easy to remember, right? And then Part C, I think of it as standing for choice, because these are options. No one is required to sign up for a Medicare Advantage plan. Sometimes that's something that, folks are confused by. They think, oh, I've got parts A, B, and D. When do I need to get Part C? Well, maybe never. That might not be the best option for you. So there are lots of things to consider when trying to decide which direction to go in or whether or not to switch back and forth. But a Medicare Advantage plan is typically where you are assigning all of your Medicare coverage to a private insurance company. In LA County, most of those Medicare Advantage plans are HMOs, and then there are a couple of PPOs. So thinking about the original Medicare model with a standalone prescription drug plan, you're working with a drug plan that only covers your drug coverage. You keep using original Medicare for your Part A and B services, and original Medicare is accepted at almost every hospital, almost every doctor throughout the entire country. So sometimes I hear people referring to original Medicare as a PPO. I don't want you to do that. It's not a PPO. It is original Medicare. It is a fee-for-service type model where you go to any doctor that accepts Medicare, and then you have a standalone drug plan for your prescriptions. You typically do not need prior authorizations or referrals when you have this model. And the thing to keep in mind, so all of that sounds great, right? So let's say you're getting services and then you think, actually I want a second opinion at MD Anderson in Texas, or I want to go to Sloan Kettering in New York, right? We know Medicare is going to be accepted in those places. However, the thing to keep in mind is that original Medicare typically only covers 80% of your approved healthcare costs through Medicare, which means that if you go this route, you're also going to want to make sure that you have some type of secondary coverage for your Medicare to pay those copays or coinsurance. So if you are here in LA and you have Medi-Cal is an excellent secondary coverage option. I'm not going to go into much detail today about Medi-Cal eligibility, but it is for folks with low income. But it operates as a really excellent secondary coverage. Most other people who go this route with original Medicare and a standalone drug plan who don't have Medi-Cal are looking at a Medicare supplement plan, also known as a Medigap. I will share a little bit of information about Medigaps, in a couple of slides. So thinking about the drug plan options, those standalone drug plans, what are some things to consider? Well, first, which plans actually cover your medications? How much is the monthly premium, right? How much do you have to pay out of your pocket every month to remain covered? What is the annual deductible? The deductible is how much you are paying out of your pocket before the plan kicks in. And then the copays, right? How much are you going to pay at the pharmacy when you actually fill your prescriptions? Other things to consider, are there special rules like prior authorizations, quantity limits, step therapy, right? Step therapy is where they might require you to try a less expensive drug before they'll approve a more expensive medication. And then, of course, is your preferred pharmacy and network. Some people really have a strong preference for certain pharmacies, so that is part of the consideration as well when we're thinking about which plan might make the most sense for you. So I mentioned if you go this route with a standalone drug plan and you've got that red, white, and blue Medicare card for your Part A and Part B hospital coverage, there's typically 3 different options for secondary coverage. I mentioned Medi-Cal already. Some places offer what's called retiree coverage, which can operate sort of like a secondary plan. Sometimes the retiree coverage is a Medicare Advantage plan, but I'll give you an example. At USC, for example, they offer something called USC Senior Care that operates like secondary coverage. You use original Medicare for your services, and then the USC Senior Care pays the copays. So that's just something to keep in mind if that's an option. But a lot of folks do look into these Medicare supplement plans, also known as Medigaps. So a Medigap is a private insurance policy that covers some or all of Medicare's copays and deductibles. They are standardized plans, so it's easy to compare apples to oranges because you're comparing apples to apples and oranges to oranges. A plan F is a plan F. A plan G is a plan G. They cover the same things, just at different companies. Some of these plans offer a foreign travel benefit because Medicare does not cover you outside the country. They are governed or regulated by the California Department of Insurance. And one thing I will say is that the Medigap plans here in California, if you are on Medicare under age 65, because you've been on SSDI, these Medigaps can be extremely expensive. The other thing I want to mention about Medigaps, and the reason I'm bringing this up at all, is because when we think about the open enrollment period for Medicare, we are talking about drug coverage, whether that's through a standalone plan or a Medicare Advantage plan. And there's a lot of information out there that says, oh, you can switch back and forth. You can always switch back to original Medicare. You can always switch to a Medicare Advantage plan. You could switch back and forth every year, which is in fact true. You can switch back and forth if you pick a Medicare Advantage plan at first and then decide later you want to switch to original Medicare. You can do that. The issue may be whether or not you can get secondary coverage at a later time. So the issue with Medigaps is that they're not health insurance. Health insurance under the Affordable Care Act, also known as Obamacare, cannot discriminate based on pre-existing conditions. Medigaps are not health insurance. So everyone who gets Medicare has an open enrollment period to get a Medigap those first 6 months that you have parts A and B together for the first time. However, there are certain other circumstances that will allow you to sign up for a Medigap at other times in your life, but they are pretty limited. And so, in the context of this presentation, I know folks here are coping with a cancer diagnosis or maybe have family members that may be doing that. Obviously, cancer would be considered a pre-existing condition. So the thing that always sort of breaks my heart is when someone has been in a Medicare Advantage plan for a while and then realizes or decides that they want more flexibility. They want to be able to go get services at different hospitals or with different oncologists. And they may have a hard time getting a Medigap plan down the road once they already have a pre-existing medical condition. So if you have questions about Medigaps, you're welcome to give our agency a call, but I did want to flag this because yes, during open enrollment, you can switch back and forth between original Medicare and Medicare Advantage, but whether or not you can get a Medigap or a secondary policy to help cover those copays is a separate issue because these plans are not governed by the same open enrollment period. So thinking about original Medicare with a prescription drug plan, things to consider. You have the most flexibility with this model, but you may have significant monthly costs. Everyone pays the Part B premium, unless you have Medi-Cal and the state pays that for you. The Part D plans, the drug plans, they vary how much they charge on a monthly basis. If you're getting a Medigap, those could be very expensive depending on your age. If you're on disability and getting Medicare because of disability and you're under 65, those Medigaps could be $300 a month or more. Once you reach 65, you'll have another open enrollment period that would lower those prices, but this can be really expensive. And then if you need dental or vision coverage, this is something else you might have to pay for on a monthly basis or pay out of pocket because original Medicare does not cover these things. So the monthly premiums can be very significant with this model, but then typically if you have original Medicare with a Medigap, you're paying almost nothing at the doctor's office, maybe just the deductible for Part B, which next year is $240 for the year. And then, of course, your drug plan copays. So lots of money out of your pocket on a monthly basis for that coverage, but then typically less money out of your pocket or almost no money out of your pocket when you're actually getting medical services. Okay, switching gears here. Medicare Advantage prescription drug plans. These are plans that contract with Medicare to provide all of your Medicare benefits. So you're assigning your Medicare benefits to a private insurance company. Most of these plans, as I mentioned, in LA County are HMOs, which means that you're working with your primary care doctor who's managing your medical care. You're getting referrals to specialists. You may have to get authorizations for certain services by a medical group. And then typically you can only use out-of-network doctors for emergency care or urgent care. So a more limited network. There are certain types of Medicare Advantage plans called special needs plans. And these plans provide services to people that have certain specific special needs. So there are chronic care plans for people with certain types of chronic illnesses like diabetes, end-stage renal disease, etc. There are institutional plans for people who live in certain institutions, like a nursing home. And then for folks that have Medicare and Medi-Cal, another option is what's called a dual eligible special needs plan, which also known as a DSNP, which helps combine those Medicare and Medi-Cal benefits. So although I mentioned that, there can be more limited networks, you're getting authorizations, you have to work through a medical group for a lot of stuff related to your Medicare Advantage plan. There are some significant benefits to having a Medicare Advantage plan, and one of the primary ones is the cost, because they generally, instead of that 80%, 20% split where you're worrying about how much money you're going to be paying at the doctor's office or at the hospital, they have typically set copay amounts. So you'll know, oh, it's a $25 copay for this type of visit. It's a $100 copay for the emergency room. It's, however much that is, it's already outlined by the plan. It's not a percentage of some unknown number, typically. Medicare Advantage plans also have an annual out-of-pocket maximum. Original Medicare does not, and that's part of why we talk a lot about getting that secondary coverage, because if you're going for IV chemotherapy and that's covered through Medicare Part B, and you don't have any secondary coverage, who knows how much your medical bill would be for that chemo. Whereas with a Medicare Advantage plan, it might be a little bit more straightforward. You do not get secondary coverage when you have a Medicare Advantage plan. So these plans are typically cheaper than buying a Medigap because everyone pays that Part B, as in boy, premium. Typically that's deducted from the Social Security check. But beyond that, you might not have an additional monthly premium for that drug coverage. You're not paying for a Medicare supplement plan. And many of these Medicare Advantage plans include additional benefits not covered by Medicare. So they can add all sorts of supplemental benefits like dental and vision. Some of them offer transportation to medical appointments. Some of them offer over-the-counter drug benefits. We hear sometimes about silver sneakers or gym memberships, but there's all sorts of additional benefits that they can add, often at no extra cost. So Medicare Advantage may be somewhat more limiting in terms of which doctors or hospitals you can use, but they might be a much less expensive option and provide more comprehensive coverage. So the first thing that I'm going to emphasize this a couple of times today, but I really want to make this clear. Not every doctor or hospital accepts Medicare Advantage plans. And of the plans available, there's like nearly 100 Medicare Advantage plans just here in LA County. Not every doctor or hospital that accepts Medicare Advantage plans accepts all of them, right? So we've got pretty much every insurance company under the sun sells Medicare Advantage plans. Humana, Blue Shield, Aetna, AARP United Healthcare, SCAN, Anthem Blue Cross, WellCare. There's so many options, and each hospital or doctor decides which plans they want to contract with. And sometimes that changes from year to year. So I can't emphasize this enough. If you or your family member has a doctor or potentially an oncologist or other specialists that you want to maintain a relationship with, or if there are specific hospitals or hospital systems you want to make sure that you can continue to use, the first way to start narrowing down your options with respect to Medicare is to confirm with those doctors or hospitals which plans they accept. Because the last thing I want to hear, which we hear far too often, is, oh, I saw a TV commercial, everything sounded so great, I signed up for this new plan, and now, my chemo is being disrupted because my oncologist doesn't accept that new plan. Or my primary care doctor is no longer in the network, and now I have to get all new doctors, right? What a mess. That can be avoided. Other things to consider: how much are you going to be paying? Are your prescription drugs covered? How much will they cost? And then, of course, what additional benefits does the plan offer? So I want to give a couple of scenarios here that I think are helpful in illustrating some of what I've just mentioned. So Maria, she's retiring next year. She lives here in California. Her daughter and grandchildren live in Arizona, and she plans to visit frequently to help with childcare. She keeps hearing about Medicare Advantage plans, but she wants to be able to go to the doctor for routine care when she's spending time in Arizona. Maybe she's a cancer survivor and wants to make sure that she has, an oncologist that she could go see, or a primary care doctor that she could go see in Arizona for follow-up visits if she happens to be spending extended amounts of time there. So because she wants to be able to get routine care outside of LA County, she should really consider Original Medicare with a Medigap so that she doesn't have to worry about getting referrals or going out of network when she's away from home. Here's a different example. Henry has had the same insurance coverage through work for a long time. It's an HMO. he likes his coverage, and he was recently diagnosed with a chronic health condition and wants to make sure he can keep his specialists when he switches over to Medicare when his employer coverage ends. Henry is concerned about his medical expenses and needs to keep his monthly costs as low as possible due to his limited income. Henry should talk to his current doctors about which Medicare Advantage plans they accept, if any, to help him decide how to obtain his coverage. Okay, so moving along here, I'm going to talk a little bit about other enrollment periods for Part D or Medicare Advantage plans through Medicare. So I mentioned this earlier. Everyone who becomes eligible for Medicare has what's called the initial enrollment period. So that's that 7-month period that surrounds the month of eligibility. So if you're turning 65, starts 3 months before the month you turn 65, includes the month that you turn 65, and then 3 months after. If you're becoming eligible for Medicare due to disability, this initial enrollment period surrounds that 25th month on disability. So that's also a time you could sign up for a drug plan. If you have other coverage through an employer, through yourself or a spouse, that's no problem. You can delay the Part D enrollment until later. I'll tell you for how long in a moment. But we've already talked about the open enrollment period that we're currently in. And the other period I want to mention is the Medicare Advantage open enrollment period. So let's say you start the year on January 1st enrolled in a Medicare Advantage plan, either one that you had previously been on, or you've made a change and you've switched into a new plan. If you start the year in a Medicare Advantage plan, you have one more opportunity to make a change to your coverage between January 1st and March 31st. This used to be called the Medicare Advantage disenrollment period. So for folks that make a change during open enrollment, join a new plan and realize, oh no, my doctor's not in the network, you're not necessarily out of luck. You may have the opportunity to switch to a different Medicare Advantage plan or switch back to original Medicare. But again, keeping in mind that if you switch back to original Medicare, you need to make sure you're also able to get secondary coverage at that time. Now, we also have something called Part D special enrollment periods. And this is for when you can change your drug coverage outside of those other periods I just mentioned. Typically, there's some type of life event that takes place, and that is what allows you to qualify for a special enrollment period. So let's say you had employer coverage and you ultimately leave your job or stop actively working, retire, any of those things. Losing employer-based drug coverage triggers a special enrollment period to get drug coverage through Medicare. If you move out of your Part D service area, let's say you're here in California now and you decide, you know what, I want to move to Hawaii. I'm going to spend the rest of my life in Hawaii or move there temporarily, whatever. If you move out of your Part D service area, that also opens up an enrollment period to get a new plan in your new service area. Entering or leaving a nursing home is another common example. And then if you have what's called the Extra Help Program, also known as the Part D Low Income Subsidy, that program allows you to make changes to your drug coverage up to once per quarter. Now, technically, enrollment into Part D is voluntary. So that's why I said if you have employer coverage that's just as good or better than the Medicare drug benefit, then you don't have to get into a Medicare drug plan. Another example of creditable drug coverage is VA drug coverage. If someone's a veteran and they get VA drug coverage, you typically do not need to get a Part D plan. The issue we run into sometimes, though, is folks say, oh, I don't take any prescriptions. I'm not going to sign up for a plan yet. I'll sign up for one down the road. In theory, you could do that at any time during open enrollment, or if you qualify for another special enrollment period. But keep in mind, there are lifetime late enrollment penalties if you do not have either drug coverage through Medicare or other coverage that's just as good or better than the Medicare drug benefit. So one question we get a lot, do I have to change my drug plan every year? The answer is no, you do not have to change it. But I do recommend comparing your options because the plans change a lot from year to year. Unsurprisingly, they often go up in price. They might change which drugs they're covering, right? They might change their formulary. They might even change the service area, and sometimes plans leave the market altogether, or they get sanctioned, right? They get in trouble with the Center for Medicare and Medicaid Services because they're doing something wrong. Those are all things to consider when trying to decide whether or not to make a change. I think for a lot of our clients, especially the last couple of years, the things that we've seen is the price is going up substantially for the same benefit. Why stick with a plan that's charging an extra $50 per month as compared to last year if there might be another plan available for less money that covers your drugs the same way, right? This is one of the things that we can help folks compare. As I mentioned before, sometimes hospitals or doctors will decide to stop contracting with certain plans. That could be another major reason why you might need or want to change your coverage. For example, the last couple of years, we got a lot of calls from folks that were getting services at UCLA health systems. UCLA had made changes to which Medicare Advantage plans they were going to accept for the upcoming calendar year. So for folks that wanted to stick with their doctors and be able to go to UCLA Hospital, they needed to change their coverage to a different Medicare Advantage plan. Now, keep in mind, if you have original Medicare with a Medigap, it doesn't matter which company the Medigap is through. Any doctor or hospital is going to accept that model, assuming they accept Medicare. Some doctors don't, I will mention that, but hospitals, I think it's like 99% of hospitals in this country accept Medicare. So you don't have to worry as much about switching, but the drug plans also will switch which pharmacies they work with. So just keep that in mind. And we just want to make sure that everyone's getting good coverage at the lowest cost, because we know that Medicare coverage, and especially the prescription drug coverage, can be very expensive. So now that I've shared some of the things to consider and why you may or may not want to make a different coverage choice for the upcoming year, I want to mention how to actually go about selecting a new drug plan, or how to do that comparison. So every drug plan, including Medicare Advantage plans, has their own list of covered drugs and copays. So that's the formulary. The formulary has different tiers of coverage, right? Preferred generic, brand name, preferred brand name, specialty. So there are all sorts of different levels of coverage and copays, and it depends on, where your prescription falls on that list and in those tiers as to how much you might be expected to pay at the pharmacy. But all of this information should be available on the Medicare.gov website. And this is the same tool that our agency uses to help run these drug plan comparisons. So Medicare.gov has an easy tool. Some of it's not the most user-friendly. Every year they make some improvements, but it's not perfect. But on Medicare.gov, if you have Medicare, you can create an account and log in and save a prescription drug list. That makes it easier to compare your options year to year, although we know not everyone is on the same medications forever, right? But it might, if there are certain drugs that you'll be taking a long time, it does make it easier to compare those options from year to year. You are not required to log in or have a login on the website. You can do it signed out. That's how we do it. But the way the search works is you literally enter in your prescriptions, the dosage, how frequently you fill them, 30-day supply, 90-day supply, whatever, and then your preferred pharmacies. And then it will give you a list of the results sorted by the least expensive plan option. So I know this is very small, but I wanted to make sure most of it fit on one slide here. And so this is sort of what the results end up looking like. So here on the right, it says sort plans by lowest drug and premium cost. So you know that the least expensive plan option should be the top one. That doesn't necessarily mean it's the best one for you, but it might be the least expensive. It gives you information about the monthly premiums, total drug and premium costs, the deductible, which I'll talk about in a moment, has gone up. This screenshot was taken last month, I think, before the new amounts were added. And then the other thing to keep in mind, you can sort by the type of plan, you can sort by the insurance carrier. There are star ratings listed for these different plans. So I say take that with a grain of salt. The same way like a Yelp review or a Google review, you never quite know, but it might help inform, okay, would you prefer a 4-star plan to a 2-star plan? Probably, right? That's typically based on complaints and, that grievances and that type of thing. You can also toggle back and forth to Medicare Advantage plans. So if you're trying to decide which way to go, you can toggle back and forth. You won't have to enter in your drug list twice. And I'm just going to clear my throat here for a second, so I'm going to mute myself. Okay, so moving along here. So now I want to talk a little bit about the costs for Part D, looking forward to 2024. So what you're going to pay for your prescriptions really does depend on which prescriptions you take, which plan you choose, whether you qualify for low-income assistance. So keeping in mind, the Part D plans vary in cost pretty dramatically. There are some plans that have a $0 premium. Many of the Medicare Advantage plans, as I mentioned earlier, do not charge anything extra to join those plans, and it includes the drug coverage. This year, the most expensive plan is up to $188.40 per month. Now, that doesn't mean necessarily that, excuse me, the most expensive plan is the best one. I can't really say why this particular plan is so expensive. So this is another reason why it's helpful to compare options. The Part D drug plan deductible, this upcoming year, the standard deductible is $545. Some plans have a $0 deductible. Some plans have something in between. So keep that in mind. If you're taking expensive medications and you can't afford to pay that much out of your pocket in January, you may want to look at other plans that have a lower deductible and spread the cost throughout the year. They might have a higher premium and a no deductible so that you're not stuck paying a ton of money out of your pocket at the first or second month of the year. So one thing I want to share here about Part D is that we do have what's called various coverage periods. So once you meet the deductible, you are typically paying a copay or coinsurance during what's called the initial coverage period. Once you reach a certain threshold, which this year is $5,030, you will reach what's called the donut hole or the coverage gap. Once you're in that coverage gap, you're paying 25% of the total cost of the brand name or generic drugs. Now, one thing that's new for this upcoming year is that once you reach the catastrophic coverage phase, which this upcoming year, that threshold is $8,000 for your total drug costs, you will pay $0. In the past, you still had to pay a copay once you reached this catastrophic coverage phase. But what this ultimately means is that for 2024, there is an $8,000 out-of-pocket maximum for Part D coverage. Looking forward to 2025, that out-of-pocket maximum is going down to $2,000 for Part D drug coverage. So we're really excited about these changes. This is something that we can thank the Inflation Reduction Act for. One other thing that went into effect this year was like $35 cap on insulin for a 30-day supply. So the Inflation Reduction Act is, being implemented gradually, but it should have a pretty significant impact, especially once we get to 2025, on how much you're paying for your prescription drugs through Medicare. So I've mentioned that if you have Medi-Cal, that's great secondary coverage. If you have Medicare and full Medi-Cal, you have to enroll in a drug plan. If you do not pick one and you try to keep filling your prescriptions through Medi-Cal RX or through your Medi-Cal plan, you're going to be told at the pharmacy that you don't have drug coverage. So if you don't pick a plan, and there are plans available for $0 per month if you have Medi-Cal, Medicare will assign you a plan automatically. Now, one of the benefits of having full Medicare and Medi-Cal together is that you have very limited prescription drug copays. These are the low copay amounts for folks that have extra help. And for this upcoming year, you should pay no more than $1.55 for generics or $4.60 for brand name drugs if you have Medicare and Medi-Cal together. So I mentioned that this is because of the Extra Help program. So if you don't qualify for Medi-Cal, you may still qualify separately for the Extra Help program. This is governed by Social Security. There's a really straightforward application on the Social Security website for the Low Income Subsidy Program or Extra Help. And it can be really beneficial to have this type of coverage to reduce your out-of-pocket costs for your prescriptions. So another change that took place with respect to the Inflation Reduction Act is that as of January, folks with income up to 150% of the federal poverty level will be able to get these full Extra Help benefits. Now, I don't know what the new asset limits will be. Typically, when we're talking about asset limits, they're not counting a house that you own and live in, a car, certain life insurance or burial expenses might be limited, but we know that this can be sort of the deciding factor as to whether or not someone is eligible. 150% of the federal poverty level this year for a single person, just to give you some context, is around $1,843 per month in income. So it's still a fairly low income limit, right? It is called the low income subsidy, and there is a fairly low asset limit. But for some people, we know that this can make a tremendous difference in their ability to afford their prescription drugs through Medicare. So you get set prescription copays, you get a zero deductible, you can qualify for a plan that has a zero monthly premium. This can be really helpful, and our agency does help with Extra Help applications if you might be eligible. Now, one of the last things I want to mention here before I open it up for questions is related to that marketing piece. So I mentioned the TV commercials at one point. For anyone that's on this call that is already enrolled in Medicare, this is the time of year where your mailbox is probably full of brochures and flyers and postcards. You're seeing the TV commercials. You might be hearing radio ads, right? Celebrities are trying to tell you about all of the great benefits available through certain Medicare plans. Please be very cautious. There is a lot of information out there that is totally valid, right? And these plans are allowed to do some marketing. but there are certain things they are not allowed to do. They cannot conduct marketing or sales activities at educational events. So I'm educating you all. Obviously, I do not sell anything. I told you I'm not an insurance agent or broker, but if all of a sudden I start trying to tell you about, oh, sign up for this plan and I can, give me your information and I'll sign you up today and I'm going to get my commission, that's not okay. Nobody should be calling you unless they're calling from the company you already have a plan with. Unsolicited calls are not okay. We know those robocalls happen all day long, but they're not supposed to. Nobody should be coming to your door. Nobody should be calling you saying they're calling from Medicare. That's not okay. Medicare is never going to call you. Nobody should be calling you asking you for your Medicare number. Medicare knows your number. They don't need to call you to ask for it. So the other thing that I want to mention here, specifically about marketing violations and enrollment fraud, is that we hear too often from clients who say, I called my plan to get information. All of a sudden, I'm enrolled in a new plan and I never asked for that. Or people will say, oh, I called an agent or broker. I told them I was interested in joining a new plan, but only if my doctor was going to be in the new plan network. Then the agent or broker told the person, yes, that doctor is in network, no problem. They sign up, they change the coverage, only to learn that that doctor has literally never accepted that plan and they are now out of network. So if somebody provides you with inaccurate or misleading information to try to get you to sign up for something so that they can get that commission, that's fraud. That's not okay. That is illegal. And that is something our agency can try to help address by filing complaints. We can try to get you back into the coverage that you had previously. But the best way to handle this is to avoid it in the first place. So I really strongly recommend, if you are thinking about changing your coverage, speak with someone that you trust. Feel free to reach out to Center for Healthcare Rights, and we can try to talk you through your various coverage options, keeping in mind that we don't sell anything. We are not going to be the ones to enroll you in a new plan, but we can help you compare your options and let you know how to go about changing coverage if you decide to do that. But we hear just from too many people that are misled, lied to, or taken advantage of by, bad actors, unfortunately. So please be very cautious. And I would say, if you see a TV commercial, I would avoid calling the phone numbers on those TV commercials because those get really aggressive. Sometimes those calls, you think you're calling just for information and it really is a sales call and they get pretty aggressive. Okay, so in terms of an enrollment action plan, for parts A and B, as I mentioned previously, you're either going to be automatically enrolled if you're receiving Social Security benefits, either SSDI or maybe you're already receiving retirement benefits. If you're not receiving Social Security benefits in any way, you would actively enroll into parts A and or B through Social Security. Once you have your Medicare card and your card number, you're comparing your drug plan options, Part D or Medicare Advantage, through either Medicare.gov or through the plans directly. But Social Security has nothing to do with your enrollment into drug coverage. They are only handling your enrollment into parts A and B. So one way to narrow down your options, as I mentioned earlier, is to confirm with your doctors which plans they accept. Same with hospitals, right? Oh, you're getting services at City of Hope. Well, make sure you talk to City of Hope or have a clear understanding of which plans that hospital accepts before you decide to make a change. You can use Medicare.gov, the Plan Finder search tool, to compare your options, or you can call us for assistance, or if you don't live in LA County, you can contact that same statewide number I shared, which I will share again, and get connected to your local HICAP program. So these are the phone numbers. This is 1-800-Medicare. You can call 1-800-Medicare 24/7. They are available year-round, 24/7. Our agency is open regular business hours. You can always call your plan directly. And then, like I said, Medicare.gov. Got our phone number here again, as well as our website, and happy to take some questions.
Thank you, Stephanie. So much information for such a, what can be a very confusing and overwhelming topic. So thank you for giving us such a clear and concise presentation today. I wanted to let everybody know that Stephanie has offered to share her slides. So if you would like a copy of today's slides, you can go ahead and email us at info@cancersupportla.org. I will drop that in the chat now. And if you do have any Q&A, if you have any questions, please enter them into the Q&A section. We have two that I see right here. One I think is a great one to start out with. Somebody wants to make a call and talk over the phone or make an in-person appointment. Stephanie just went over the numbers, but maybe Stephanie, can you talk a little bit about how to best prepare for that appointment or specific questions people can bring?
Certainly. So in terms of the telephone appointments, the phone numbers here on the slide, if you're thinking about comparing, your drug coverage options during open enrollment, I highly recommend that you prepare for the appointment by having a list of your prescriptions ready to go. Whether you can email that to the counselor that you are speaking with, or read it. If it's a short list, you can typically read it to them over the phone. But a lot of times, because we're not medical professionals, we don't know all of the different medications out there. It's helpful to see it written down. And then, of course, having your Medicare number handy. I said no one's going to call you asking for your Medicare number. Our agency may ask you for that information so that we can check your benefits. If sometimes folks are confused about their coverage. So we are, a trusted source of that information. And of course, you have to call us first. We're never going to cold call you and ask you for that Medicare number. But the one other thing I wanted to mention is that we do have volunteer counselors that are placed throughout the county at various senior centers. If you go on our website, there's a tab that says how to get help. And there's a list of our volunteer counseling sites where you typically would call those sites directly to schedule an appointment if you prefer to go in person. Now, keep in mind, we're already in November. I know for certain a couple of our volunteer counselors have already been fully booked for open enrollment. So if that doesn't work, you can always give us a call, but I would recommend doing it sooner rather than later.
Wonderful. We have another question, which I think is great, and it's what to be aware of when attending an Advantage Plans info session being held in person.
So I would make sure that you are prepared to not change your coverage that same day. I highly recommend, educating yourself, taking in the information. I absolutely think that there are some really good agents and brokers out there that do a good job. They care about their clients. Yes, they get a commission by helping you change your plan, but many of them are very, very good. They're good people. So just keep that in mind that you can attend a session, but each broker or agent typically only works with a few specific companies. So it's possible that there could be another Medicare Advantage plan that could offer better or different services to you that agent might not work with. So you might not be getting the entire full picture, but as long as you're aware of that, I think, there's no harm in going to those info sessions, but you just might have to do a little bit more homework on your own.
And then one last question I'm going to squeeze in. Somebody was asking about dental and optical. You went over this a little bit, how to kind of look into or navigate comparing those plans.
Yeah, so dental and vision are not covered by original Medicare. Medicare Advantage plans can offer dental and vision. I see the question here. Kaiser certainly does offer dental and vision. Many of the other Medicare Advantage plans do include dental and vision, or you may have to pay an additional, $15 a month for more comprehensive dental or something like that. You don't have to go with a PPO. There are other HMO plans that offer dental and vision, but that's just part of what you would be comparing on the Medicare.gov website. If you select Medicare Advantage, you can see all of those other supplemental benefits that are covered by each of the individual plans.
Great. We are past time, unfortunately. So if anybody else has questions, you have a website, you have a phone number, you have our email, you can get the slides from today. So don't hesitate to reach out to any of those avenues. But thank you again, Stephanie, so much for coming today, and thank you to all of our participants for your great questions. If you would like to learn anything else about Cancer Support Community Los Angeles, you can visit us at cancersupportla.org. And we will see you next time. Thanks so much, everyone.
Thank you.